Good morning, everybody. Thank you so much for joining us for our virtual summit today. Our speakers and our planning committee are really excited to be able to share some great information with you today. My name is Trey Hurd. I'm with Comagine Health, which is a nonprofit quality improvement organization working in healthcare in a number of states. I am located here in Salt Lake City, and we are thrilled to welcome you today to improving employee health through diabetes prevention, a lifestyle change program that works. All right, we'll get started here. So today's summit has been brought to you by a number of organizations. The first one that we'd like to call out is the Centers for Disease Control and Prevention. They've supported our activities today through a cooperative agreement. And just know the contents are solely the responsibility of us authors and do not necessarily represent the official views of CDC or the Department of Health and Human Services. So to give you an idea of what a statewide effort our summit is today, here's a list of some folks who have contributed today. And on the left-hand side is our planning committee, the National Diabetes Prevention Program, again, CDC, Comagine Health, Get Healthy Utah, the Utah Department of Health, Intermountain Healthcare, University of Utah Health, and Bear River Health Department. We also wanted to take a moment to give a special appreciation shout outs to a few different people. One, first and foremost, to our Utah local health departments, who have been amazing partners in supporting this event and also in our promotion activities. Also, the Utah Worksite Wellness Council and CDC, as we mentioned, the National Association of Chronic Disease Directors, NACDD, Select Health, OMADA, EMI, the Utah Diabetes Coalition, and the Salt Lake Chamber. Our heartfelt gratitude to everyone who has come together to continue a conversation throughout the state of Utah about type 2 diabetes prevention. All right, let's cover some Zoom housekeeping items. I know in these days we're all a little bit more familiar with Zoom than we were previously, but we did want to just highlight a couple of items. One, if you are able to turn your camera on, we would really appreciate it. It's so nice to be able to see people, and so if you can, all you need to do is right here, just click this start video. The second is everyone did come in muted, and if you just make sure throughout the presentation that you are muted to limit any background noise, that can be located right here on your Zoom toolbar. Then next, we encourage chatting. Please chat in ideas, questions, feedback, anything that you would like to share with us. We'd really love to hear in chat. To access chat, you can see right here, again in your Zoom toolbar, it's just right here. And you can send messages to either everybody in the meeting or to specific people. So we encourage everyone to let us know what's on your mind and any questions that you have. All right. Just a little Zoom tip for those of you who are not familiar. There's a way to click into speaker view up at the top right. If you see this icon, you're not in speaker view. Speaker view will help to be able to see the camera of the person speaking as they're going through their presentation. So if you'd like to do that, go ahead and click on this little symbol at the top right. Lastly, for our Zoom housekeeping items, if you are accessing today's meeting by phone, you will need to make sure that you have linked your participant ID. That helps us to be able to route you to the correct breakout sessions. So there's some instructions here about how to do that, but the easiest way to do it is to click on the audio and to go ahead and include your participant ID. We have an amazing Zoom technological expert with us today, my colleague, Rebecca Bally-Larkin. Her name is up here in this little chat. So if you have any questions, please feel free to reach out to Rebecca via chat, and she will make sure that you have everything that you need. All right, let's go ahead. Let's test our technology. We wanted to see where everybody's from. So we've got our Utah State map up here, and there's a wonderful annotate feature in Zoom. At the top, if you, at the top of your bar, you can see view options. You click on view options and then select annotate and stamp options. You can tell us and show us where you're at. You can choose stars or hearts or check marks. Yay, look at all those people. That's fantastic. And I know that we've got a few people joining us from outside of Utah, so please give us a shout out. Let us know where you're at. There we go. Also, you're more than welcome to share in chat. I-15 corridor. Yes. Oh, this is wonderful. Look at all these folks. We'll give people just a couple minutes if they're new to Anno. Oh, thanks, Jared. That's awesome. I know that Rebecca is joining us from Oregon. We've got some friends from the East Coast joining us. Wonderful. We'll give everybody just a couple minutes because I know some folks have joined. If you're just joining us, we are testing out our Zoom functionality and we'd love to know where everybody's located. So you'll see to be able to access annotate over here on the right side are some instructions. View options, annotate, stamp options, and then let us know where you're at. Wonderful. Oh, we've got a star all the way. There's our East Coasters. We've got some stars. I like Delta. Delta is circled, and Moab. This is wonderful. So we wanted to go through this exercise, one, because annotate's fun, but two, to just reinforce that this is a statewide effort. Today, we're going to learn lots of information about what's happening in our state in regards to type 2 diabetes prevention, and we appreciate all of your partnership. Here we go. Whoops. All right, Rebecca, I'll let you clear that and then we'll move forward. Okay, let's talk through some objectives. We have quite a bit of content to share, but there are some common themes that we'll see throughout today's presentations. The first one is it's important to us that you understand the influential role the Worksites can play in type 2 diabetes prevention and in employee health and well-being. A lot of us have been at this work for a couple or a few years, and we have learned that employers and work sites can make a huge difference in getting the word out and giving people access to the National Diabetes Prevention Program. The second, we'd like to share about the benefits of an evidence-based national DPP and how to overcome some of the challenges of utilizing the program. Third, we'd like to share about how about the direct and indirect financial benefits that organizations can benefit from for implementing national DPP for work sites. And our last objective is to engage with other work sites that are interested in improving employee wellness and learn from partner organizations, which you'll hear about in just a few minutes, who have successfully participated in the national DPP. So those are our objectives for today. Thank you for your attention. Thank you for your time. Thank you for your commitment to the health and well-being of your colleagues and your organizations. All right, we'll move into our general opening session. No time like the present, leveraging diabetes prevention at your work site. We've got three very experienced, knowledgeable, generous speakers today. And we will first start with Sarah Woolsey, who is a medical director, the medical director for Comagine Health, a dear colleague of mine. She is board certified in family medicine and has worked in primary care for 20 years with underserved populations. So one moment here, Dr. Woolsey, and we'll give you control. There you go.
Thank you, Trey.
Yes.
All right. Yeah, so I'm going to click. All right, and we're right there. Okay, so again, Trey, thank you for the warm welcome. I loved seeing the map and where everybody's from. That just totally warmed my heart. So welcome to everybody, and I'll agree with the fact there's no time like the present, given the COVID-19 pandemic, given everything that's happening, to really think about prevention and wellness at our work sites. Trey shared the goals for the day, so I'm going to skip this slide, but I'm not going to spend much time on the slide, but I want to just mention I will connect to the COVID-19 current pandemic and how diabetes and pre-diabetes link. And I'm really interested in leaving you in action. So my first thing I want to do is just tell a quick story. This is from a national CDC testimonial site, so not sharing any patient information. This is Tim Enfinger, who was happy to share his story with the National Diabetes Prevention Program. And the reason I picked him is because I liked his first quote. I really want to give us a sense of who we're looking to impact and what's possible. His quote was, "I've tried a lot of different diets and nothing has ever stuck. This seems to be sticking." So Tim is shared his story publicly because it impacted his life. What he said, and this is a quote, "I've always loved food and I've never paid much attention to what I ate before. My father had type 2 diabetes and I started thinking I needed to make a change. So he enrolled in the National Diabetes Prevention Program. He did a virtual model, so that worked for him. And he just talked about a couple of things in his testimonial. One was, my coach was awesome, sending me emails telling me I was doing well, and if I had a question, she always responded. So he really enjoyed the coaching part of this, the personal coaching that came with the DPP for him. He reports also that he was pretty much your standard couch potato before the program. How many of us can relate to that? But now my wife and I go walking every day, sometimes as much as 2.5 miles. He's reporting on the increased physical activity he began in the National Diabetes Prevention Program, and he even marks the miles, which is something that you find in participants. They know how many minutes and often how many miles they've walked as they're participating, because this is an important outcome in lifestyle change. He also said, "I feel a lot better. I sleep better." This is a graduate of the National Diabetes Prevention Program, and he may look like our brothers, our fathers, people we work with. These are folks that take on a change in life for some reason, and they're looking to that bigger future of preventing a very significant condition, type 2 diabetes. So you might be like, why is she talking to me about this? Why are we talking to employers? As Trey said, you are very important to the health of this nation. You are very important to your staff, your employees, to your fellow coworkers. How many of us spend 8, 10, 12 hours a day at work? How many of us know that lifestyle activities that we engage in at work really make up a big part of our day? And if we were able to change what happens even in those hours of the day, it would significantly impact our health. So I just want to say, Tim is somebody we all know. Tim is a graduate of the National Diabetes Prevention Program, and I'd like to open up the opportunity that employers are a key driver in people looking to make this kind of change. I want to have you think about 2 questions. Whoop, as I just kicked myself out. Resume my slideshow. Our first opportunity, and I want you to think about this no matter where you are throughout this 2 hours. Number 1, is type 2 diabetes prevention important to your business model? And Trey has alluded to the kind of information you're going to get today, but I want you to keep this in the back of your mind. Is this important to you? Is it important to your mission? Is it important to your work environment? Is it important to employee retention or their work-life balance? Is it important to job satisfaction? Is it important to the bottom line? Keep this in the back of your mind. Think about this as you're learning today, and make sure you go away with something new about this question as you learn. The second thing I want to stress is, are your current wellness offerings evidence-based? This is something we're going to stress today. We're going to share the science behind this program that we think makes it extremely valuable. For the money that you're spending on a wellness program, are you getting the results that you want? Do you know? And how is national diabetes prevention a great opportunity because of its evidence-based? Okay, want to get some baseline in for definition and statistics, just to make sure we're all talking about the same thing. Maybe a review for many of you, but I want to just go through the definition of type 2 diabetes. So that's raised blood glucose, as the body can't use its naturally produced insulin from our pancreas to regulate blood sugar levels. So an example of a way that could be diagnosed is you have a fasting blood sugar over 126. Stats for type 2 diabetes: 1 in 10 Americans have diabetes, and 95% have the type 2 type, which is the preventable type. And a diagnosis of diabetes leads to 2.3 times more healthcare costs. We'll talk more about that. And about 25% of our healthcare dollars go to the care of diabetes, mostly made up in medications and hospitalizations. Why is it so costly? And this is my, Halloween gory doctor slide with some body parts, but diabetes increases the chance of very serious conditions that you see listed here: heart attack, stroke, blindness, kidney failure, and then amputations. This is why it's so costly. We want people with type 2 diabetes to get great care. We're going to take care of them. We're going to give them what they need, and that brings burden of cost. Okay, let's do prediabetes. So what's prediabetes? It's blood glucose levels that are regularly higher than normal. So the majority of hours a day, our blood sugar is higher than normal. That looks like not fasting over 126 like diabetes, but somewhere between 100 and 126, for example. So our body is starting to have a mismatch between the natural insulin we produce and our blood sugar levels from what we eat. And eventually that can tip over into type 2 diabetes. 1 in 3 American adults has prediabetes, but unfortunately 9 out of 10 people don't know. So we as physicians, we as employers, we also need to get the word out that people need to find out if they fall into that 1 in 3. We've got quite a bit of work to do. And I want to make sure you know, and we're going to talk about this, prevention is cost effective through National Diabetes Prevention Program. This is from a paper published about 2017 using 2015 cost data. And they looked at 3 years of data. How much does it cost to care for someone on a health plan with diabetes and without? And you'll see where we get that 2.3 times more expensive once someone is diagnosed with diabetes. Okay, a quick mention on COVID-19 and blood sugar control. We can't have any hour of our day not have a little bit of talk about COVID-19. I just want to make sure people are aware, blood glucose control is important not only for people who have a diagnosis of diabetes, but also those who don't have the disease. We'll see here our statistics in Utah. We have a higher proportion of folks hospitalized that are people with diabetes. We're working hard to take care of them, but we know that diabetes is a risk factor for hospitalization for COVID-19, and having higher blood sugar is also important. I'm going to do this slide and then I'm going to come back. This is a slide from the Centers for Disease Control and Prevention that has recently come out that talks about your risk of being hospitalized from COVID-19. You'll see 3 things highlighted: obesity, diabetes, and severe obesity. These are all conditions in which many people have higher than average blood sugar. These may be people, the obesity and severe obesity, who are pre-diabetes diagnosis. They don't know yet. But look at that list. You are 3 to 4 to 4.5 to 5 times more likely to be hospitalized, which means you have a very severe case of COVID-19 when you have these conditions, and many of them are blood glucose connected. Back to this slide. This is a public service announcement for everybody. If you have someone in your life, in your employment, who has diabetes, it's really critical to help them effectively manage their blood sugars and to keep them safe from COVID-19. Also very important, if they have any signs of the severe conditions like stroke or heart attack that come with diabetes, that they seek medical attention and that they don't stay away from medical care. Okay, last thing, it's a wake-up call. Okay, we know that the pandemic is a wake-up call for all of us to be more well. We know that we can work to mitigate the risk of illness from both diabetes and COVID-19. This is something we can actively work on. There's lots of things we can't work on, but this is one thing we can work on. Okay, this is a question. Get your chatting fingers ready. I want you to think about things that are preventable. Chat in prevention care that's covered in your health plan in your workplace. So if you cover it because you're paying for the health plan, or you're part of a health plan, what kind of things are prevented? What do you pay for that's prevention? So I know for myself, my health plan wants me to get a flu shot. Okay, physicals, flu shot, very good. Vaccines, excellent. Some people, I'm sure most people cover the pap smear. Let's say cancer prevention. Good. Cancer mammograms, wellness, excellent. You guys are getting it. Good. Okay. Smoking cessation, love that one. One of my favorite topics. Okay, good. Excellent. So you guys kind of get this. Question: do you cover care to prevent type 2 diabetes? Is that on the list? Okay, another question for you to be thinking about today. Okay, National DPP, what is it? What's that class that our friend Tim took? It's a 16-week first session. So once a week for 16 weeks, people come to a class, they learn about lifestyle change, then they go back into their life for the rest of the week and implement it and come upon challenges and have successes. And they have a coach and they have a structure to keep them learning through those 16 weekly sessions. So that's the first 6 months. Then the second part, they have a maintenance where they put this into their life, but they still have check-in sessions because we know that change takes time. They lose 5 to 7% of their starting body weight. Okay. For those of you sitting there on the webinar who've got a phone with a calculator, what is your last weight and what's 5% of it? You'll be shocked at how few pounds down can really make a difference in preventing a condition as serious as type 2 diabetes. So I will have no issue if you guys get on your phones right now and calculate what's 5% of your body weight that you would lose if you're a pre-diabetes person to move you into a lower risk category. And then we want people to increase their physical activity. Like Tim, they're counting their miles, they're counting their minutes. Okay, that's objective measurements of change. You get an in-person class or an online class or a live virtual class. You get a coach, as we mentioned, that supports you and understands what you're going through. You get people just like you in the class, and you get that 1 year of support. That's the class. Does it work? This is the evidence-based part. Okay, the outcomes, and this has been well studied in many different kinds of communities and different formats. People cut their risk of developing type 2 diabetes by 58% at 3 years. And it's more effective for people over 60. Long-term, we saw long-term prevention of diabetes for people that took the program. And if you were going to have diabetes, it delayed it longer. Okay, usually about 4 years or longer. And that's really important because any year that we prevent a diagnosis of diabetes, we prevent those extra visits. We prevent those extra medications, those specialist visits, and the long-term effects that lead to things like strokes, heart attacks, kidney failure, blindness that I mentioned earlier. So any year we delay really makes a difference. Okay, so our opportunity, think about this today. Learn about the diabetes prevention program. That's what we're here for. We want you to think about, is type 2 diabetes prevention important to your business model? Do you cover care for this? And are your current wellness offerings evidence-based? Okay, so be thinking about that as you learn today. You and your organization, we know you make a difference. We thank you for being here, for being interested. And I'm going to turn the time back to Trey. Thanks so much.
Thank you so much, Dr. Woolsey. We really appreciate that. We'll move into our next speaker here. One moment. Joanna DiBenedetto. Joanna is a public health consultant for the National Association of Chronic Disease Directors. And as a subject matter expert in the field of diabetes prevention, Joanna has been working with a CDC-led National Diabetes Prevention Program since 2012 and is also a National DPP Master Coach. Joanna, I'm going to mute myself and then it's all you. Just 1 second here.
Oops, thanks, Trey. Let me stop clicking so fast. I think it's taking 1 second to take over the slide deck. Yep, I think I have control now. So again, thank you, Dr. Woolsey, for that explanation. That was a really nice presentation on everything that is the National DPP. I'm going to take us one step lower. So talking a little bit less about the actual program in and outs themselves and a little bit more about, you know, from the employer perspective, what can you do to potentially look at the National DPP and incorporating it into your program. So I'm preaching to the choir, I think, with this slide. But this is something, you know, we all have to consider, you know, why should employers care about health? And I think Dr. Woolsey, again, covered that pretty well, but we'll talk about that a little bit more. And then, you know, looking at the scale itself, the cost of diabetes treatment, we covered, looking at the cost, even in the very early years of diagnosis, they might not have all of those complications right at the beginning. Sometimes those complications take time to come into effect, but looking at the cost of diabetes treatment, again, early on, as much as $8,000 per individual. And then the cost of covering this program for an individual is around $500. Of course, that changes based on provider, but at the same time, the cost, has been shown to be really dramatic in between, prevention versus treatment. Looking at the employer decision-making process, this is probably very remedial as far as how you all make your decisions as far as what to include as a covered benefit. But first you have to know what the program is, be aware of the program, be aware of the risk that your employees are facing. The consideration component, which we hope that's probably part of what you're doing today, is starting to learn about what this program is and how it would or wouldn't make sense. Moving into the dollars and cents and the components of implementing the program, and then looking at the success. Are people enrolling? Are they, like Tim, are they successful in the program? And then hopefully scaling that program within your organization. So as Dr. Woolsey said, this is an evidence-based program. It was studied. It's been studied for many, many years, and that's what really makes it a standout program versus other, education classes, maybe about diabetes or other wellness programs that are maybe more geared towards generally healthy people who might not be at high risk for developing type 2 diabetes, like people who have prediabetes. And CDC has really put a lot of funding into promotion of, continuation of studying, and really, again, starting to look at the nuts and bolts of how to cover this program and how to scale it nationwide. So through that work, NACDD and my team have we actually did a demonstration project around Medicaid coverage of the national DPP. And through that work, we developed this tool called the Coverage Toolkit. I know toolkit gets used a lot, but ours is called the National DPP Coverage Toolkit, and the URL is right there, coveragetoolkit.org. We were very happy that URL was still open. But after the Medicaid demonstration, we really started to look at all the various payers, including private payers like employers and commercial health, and have put really extensive work as well as lessons learned from the field of people and employers who are actually implementing this program to give you hopefully all the tools and resources you need to learn what you need to know, to be able to get approval from anyone within your leadership, to cover the program, and then all the steps it takes to actually implement the benefit and roll it out successfully. So I'm going to walk you through the toolkit a little bit. Feel free to go actually online. The toolkit is live. It's right there ready for you. I just didn't want to make us dizzy by kind of clicking in and out a live website. So I took a lot of screenshots of the actual website so you can get a look and feel of it. This is the top bar is more or less the top bar on the actual website itself. And as you can see, we have a national DPP section, a participating payer section, which I'll go into a little bit. And then the rest of the toolkit is designed to speak to specific payers. So you all would probably be most interested in the commercial payer section, which again, I'll go into a little bit more, but that's where we have anything that is a private payer relevant information. So let's talk a little bit about the national DPP section. In the section, you can find things like evidence behind the program. You can find things about all of the studies that have been done. There's a plethora of information under this tab, but for today, we're going to focus on the cost and value of the program because that's probably most relevant to some of you in this conversation. So in this section of the toolkit, we talk about analyzing the cost of coverage itself. We have some budget and impact tools, some that we've created, as well as some that are out there. We link to AMA, American Medical Association. They have a cost calculator. CDC has an impact toolkit. All of those different budgets do slightly different things, or those calculators do slightly different things. So you might want to use all three for different reasons. You might want to use one versus the other. We do take time to really explain which calculator does what and what information you need. But really, a lot of information on looking at the return on investment or ROI of the program, as well as the value on investment. We know that there are other elements to this program that have a value. They might not have a monetary cost right up front, but it might, look at, increasing things like employee productivity, lowering absenteeism. It could also look at just employee satisfaction in general. So we kind of try to take a look at the whole entire picture when it comes to the cost and value of the program. And this is a study that we linked to on the toolkit itself, but I wanted to kind of pull out, again, I know I'm probably preaching to the choir, but this study was done by the National Business Group on Health and Optum, and reported back that 91% of employers reported offering their health and wellness programs for reasons beyond the medical cost savings, which we know there are cost savings when it comes to this program. Some of it is how you design the program. Some of it is, who you work with. So that margin may or may not be big, but there are other components to this program that make it very valuable, including, the reduction in health risks, the reduction in costs, but also that improvement in employee productivity and satisfaction. Again, talking about the secondary benefits of the program, there's all of these other elements, right? That when you talk to losing that modest amount of weight, that 5 to 7% of weight loss, that things start to trigger in people's body that start to kind of lower things across the board that might not have been involved in the original study, but we've heard, at least anecdotally, we see oftentimes people coming off of lipid medications, people's blood pressure, lowering, all these other, elements that have these, correlating positive effects. And then, of course, looking at, again, that increased productivity, improved quality of life. Those things are hard to kind of put a number on sometimes, but there is a value there again. And looking at that beneficiaries and employees might be more likely to stay with a health plan or an employer that if they offer quality and satisfactory programming, which I know also can be a competitive edge for you as an employer. There's another section I wanted to highlight today that's on the coverage toolkit. It has its own tab there at the top. It's participating payers. So this is a page that actually identifies any organization that's publicly announced that they cover the national DPP. So we have this developed into sections, including commercial health plans. We have a section on employers, and we have a section on state health employees. I think there's 26 states that their state employee plans cover the national DPP for their state employees. There are lots of information on that. I think I have another slide that talks a little bit more. Yeah, there's filterable charts where you can go on and you can look and see a like entity to you based on industry, based on size of employer. So you can start to see, does this make sense for me, for my employer group? Is anyone else like me doing it? A lot of people don't like to be first, so we try and showcase that. And then, if there is an employer, we just give a plug that you know of, or a commercial plan that you know of that is covering it that's not listed on here. Let us know. We obtain this information in lots of different ways, but we always like to be as relevant as possible. The other, benefit of this page is, that recognition. A lot of these employers are outstanding. You can tell that they're focusing on wellness, and we hope it gives them also some recognition that, that they are, again, putting their employees' health, on the forefront. So I would suggest looking at that section. So for the rest of the time, I'm going to really focus on, again, the commercial payer section, which focuses on private payers. These are all the different subsections under that tab. So we talk about delivery of the program. As Dr. Woolsey said, there's a standard formula for the program itself that everyone must adhere to be a CDC recognized program. And that's to tie back to the evidence. And that's where we get the ROI. That's where we get the specific reduction in risk that we can kind of, hang our hats on in a sense. But the delivery can be done in many different ways. It can be done in person, it can be done online. In COVID, that's especially important to do. You can do this class entirely virtually, and there is evidence that ties that it is just as effective as in person. So there has already been studies done on that. There's a section on reimbursement itself, coding, billing and coding elements. This can be a per class per session fee schedule, or it can be based on metrics and markers that people meet. So those can be, kind of negotiated depending on how you actually roll out the program. Coverage and practice section gives you examples of, again, payers that have actually done it, some case studies, some words of advice, lessons learned, et cetera. So I would recommend you take a look at that page. The coding and billing gives you like very nuts and bolts look at how to actually start to take this and work it into any of your systems. Contracting really talks about contracting with any CDC recognized program provider that you might want to outsource this to. And then data and reporting, again, gives you lots of information. So all of those sections should have pretty much everything you would need to know in order to move forward. But today I'm going to focus a little bit on this case for coverage section, which is, have to be honest, it's kind of my pride and joy. It really is a page designed to take you step by step through the entire program, from that contemplation stage to that, scalability stage. So we have this section really broken out into like looking at where are you in the process. There's a self-assessment to decide, am I just starting to learn about this program, or do I already know about this program and I'm ready to really hit the ground running and start planning the benefit. There's also, lots of templates and resources on this page. I'll start with this one, and I'll explain a couple of the other ones that I want to make sure to highlight. This is a step-by-step guide to using the toolkit itself. So when you see this tool is basically kind of what I'm telling you right now. It tells you the different sections of the toolkit, and it gives you hyperlinks. So if you open it in an electronic format, it'll take you right to that participating payers page or the data and reporting page or anything else you need to know. So if you want a tool or a tour guide of the toolkit itself, because the toolkit is very dense, I'll be honest, it's dense, it has a lot of text. So this kind of helps break it up a little bit and makes it very specific for employers. The next resources I want to highlight are these, again, tools all on that case for coverage section. So there's that readiness assessment that you can take virtually, or you can print out, and it's a PDF and you can take, and it kind of assesses where you are in the process of the national DPP. There's a barriers and FAQ docs. These are frequently asked questions from payers themselves, where we try and kind of answer questions that you might likely have right off the bat. There is a pathway to coverage document, which again takes you really step by step, very nitty gritty on actionable items you can take to plan your benefit. And then the key questions employers to ask your health plan. This is a good one, and this is one that is actually relatively new. This is something that we noticed that there were some employers who were kind of going halfway down the road and then realizing they hadn't really engaged with their health plan to see if their health plan offered this as a covered benefit already, if their health plan knew about it, if their health plan would cover it, if they asked them to. So this is a good document, again, to kind of start with and start that conversation before you get too far down the road. So again, this readiness assessment I talked about, there's a part 1, which is really for organizations interested in learning more about how to cover the program. And then there's a part 2, which is organizations that we already know about the program. We've already been sold on the evidence of the program. Now we're ready to plan our benefit and implement it. So there is kind of like a delineation between the two. So just kind of think about which one applies best to you. And again, this isn't anything set in stone. It just helps you get a better idea of where you are in the process. The barriers and FAQ topics, these are questions that if you haven't already thought about them, you might, or somebody in your leadership might ask you. So, you know, can I offer this program to all of my employees? A year is a long time for a program. Can't we just shorten it? Can't we do a 6-week or a 6-month program? Their 6-month version? That question gets asked a lot. So we have some answers to that. And the answer is really, again, that change takes time. And the reason why this program works, the reason why it cuts the risk in half of developing type 2 diabetes is that it takes that year to really instill those habits. How long does it take to see the ROI? How can I ensure good recruitment and retention? Just because you build it doesn't mean they'll come. So we talk a lot about how to make sure to set up the program so that you know, you're targeting the right people, that they're enrolling in the right way, that you consider, you know, marketing, communications, incentives, anything like that to make sure the program's a success. You know, should I do a pilot program first with a smaller subset before I roll it out to my entire population? So again, all of these questions and hopefully some answers can be found in that document. The tools I talked a little bit about with the cost and value page, they are on the cost and value section, and we also included them here just to make sure that whichever page you're accessing on the toolkit, you have a place to access all the tools. This template we're really excited about. This is actually pretty much if you're deciding to cover the national DPP, how to budget for it, how much is it going to cost you at the end of the day. And again, there's some options, there's some customization that you can include, such as your reimbursement model, the fees that you're actually going to pay, those vary, and how many people you're going to enroll. So this kind of walks you through of how to budget for your program. It gives you a total estimated cost and an average cost per participant so that you can budget that. And then this is kind of our crown jewel. This is the pathway to coverage. It gives you everything you need to know in actionable steps, step by step, so that you can take this hopefully as your game plan, your playbook, and actually make the business case and then just plan and design your benefit and roll it out. So again, take a look at the pathway to coverage document on the toolkit, and it does link to the other sections that I mentioned earlier. And yes, I think that's it. And I think I'm 1 minute over, but hopefully that was information. There's the toolkit URL again, and feel free to contact us if you have any questions.
Joanna, thank you so much. That was wonderful. And just to everyone out there, just know that there is a whole team of people to help support you through this consideration process and in using all of these resources. And we'll be sharing contact information at the end, and we'll also be reaching out to each of you to see how we can support you. All right, we are moving to Natalie Klein from the Utah Department of Health. Natalie is part of the Utah Department of Health's Healthy Living Through Environment Policy and Improved Clinical Care Program, also known as EPIC. Natalie is also a lifestyle coach and a Master Trainer Select for the National Diabetes Prevention Program. Natalie, give me 1 moment to give you control. There you go.
Thank you, Trey. And thank you, Dr. Woolsey and Joanna, for presenting. I swear, every time I hear them speak, I learn something new about diabetes or the coverage toolkit. So we were very lucky to hear from both of them today. And I'm also hoping that my technology goes as seamless as both of theirs did. So we'll see how this goes. We're going to talk a lot about diabetes, prediabetes, and the National Diabetes Prevention Program today. And I wanted to give you a quick look of what each of these look like within the state of Utah. One moment. Okay. As a state, we are pretty healthy and have a lower percentage of diabetes compared to the rest of the U.S. The U.S. diabetes prevalence among adults is around 10.4%, and within Utah, we're right around 8%. Even with being a healthier state, we do see an increase in diabetes rates as our adult population ages. This graph depicts all types of diabetes, including type 1 and type 2. A person's risk for type 2 diabetes actually increases as we age. You can see that's true even in Utah. Type 2 diabetes prevalence increases as Utahns get older, and that accounts for the large increase in the percentage of adults with diabetes. The 65 plus age group range has diabetes prevalence that are 2 to 3 times higher than the prevalence of all Utah adults. In Utah, we have just shy of 10% of our adult population reporting that they have been told by their provider that they have prediabetes. And 1 in 3 Americans actually has prediabetes. When we apply this statistic to our Utah population, we're looking at a number that's closer to 760,000 Utah adults actually having prediabetes. That's over 500,000 adults in Utah who do not know that they have prediabetes. When we look at prediabetes rates in Utah, we see something similar to our diabetes rates. For the most part, we see the percentage of adults with prediabetes increase as we age. Our adult population up until we retire is our workforce. The 18 to 64 groups represent all of us. If we can intervene when someone has a diagnosis of prediabetes, we can prevent many from having developing type 2 diabetes in their later years. So what is the National Diabetes Prevention Program in simplest terms? The National DPP is a year-long CDC recognized and most importantly, an evidence-based program that prevents type 2 diabetes. The overarching goal of the program is to prevent or delay the onset of type 2 diabetes. The program is facilitated by trained lifestyle coaches. DPP participants meet together for 22 weekly 1-hour sessions with their lifestyle coach over the course of a year. The picture in the bottom right is actually from the last in-person lifestyle coach training we were able to hold before the pandemic hit. We had 12 individuals from 6 different organizations trained as lifestyle coaches in Utah. So people are eligible to participate in the program if they're an adult, have a BMI of 25 or greater. If they identify as Asian, they have to have a BMI of 23 or greater. Not currently pregnant, they do not have a previous diagnosis of type 1 or type 2 diabetes, and have a blood test result in the prediabetes range within the last year. If a person identifies as female, if they had a previous pregnancy with a gestational diabetes diagnosis, that counts as the same measure as having a prediabetes blood test or a blood test in the prediabetes range. Throughout the entire year, participants meet together either in person or virtually and support one another. Participants learn to improve nutrition through modifying eating habits, learn ways to increase physical activity, how to manage their stress, and even how to get back on track if their motivation starts to wane. I literally know this sounds super cheesy, but I do love this program. I've seen the positive impact it can have on employees and their families. I know that permanent lifestyle changes take time and practice, but the National DPP provides a supportive environment where lifestyle change is possible. So in Utah, we've had over 5,200 adults participate in the National Diabetes Prevention Program since August of 2015. We currently have 21 organizations offering the program and over 200 lifestyle coaches who have been trained to facilitate the program. Over 50% of the DPP participants heard about the program through their employer. We love when employers either promote the program or offer work release time for employees to attend the DPP. Learning about the class through their employer offers an extra layer of support for these participants. So this map depicts both prediabetes prevalence and the national DPP providers in the state. The darkest areas, such as Tooele and Weber Morgan, have prediabetes rates that are higher than the state prevalence. The salmon or medium color indicates areas that have a prediabetes prevalence similar to the states. And then Bear River and Tri-County with the lightest color have prediabetes rates that are below the state prevalence. As I mentioned a few moments ago, in Utah, we currently have 21 organizations offering the national DPP. Some of these organizations, like our health systems, offer the program in multiple locations, hence why there are more than 21 dots on the screen. The green dots represent national DPP provider locations, and the green area surrounding the dots represent a drive time of 30 minutes or less to those locations. You can see the Wasatch Front, we have many DPP providers locations currently. We have organizations such as the University of Utah that offer an online version of DPP that eligible Utahns are able to participate in. Because of the current public health emergency, most of our DPP locations have either transitioned or will transition by 2021 to being virtual delivery modes. And the organizations listed are those currently offering the National Diabetes Prevention Program. You probably see quite a few familiar names listed. organizations listed are Worksites offering the program for their employees. Others, such as our local health departments, health systems, and community-based organizations, are accepting referrals from employees to their classes. And then in closing, in Utah, we have a coalition dedicated to increasing awareness and sustaining the infrastructure of the National Diabetes Prevention Program in our state. This group also focuses on improving statewide efforts for diabetes prevention. We know the work of diabetes prevention and the National DPP can sound overwhelming. We essentially have a team of experts throughout the state who are more than happy to help find the best fit for diabetes prevention at your work site. If you have questions about programs in your area or want additional information, we can introduce you to one of these team members who can help assist you. I'll now turn the reins back to Trey so she can introduce the next piece of the agenda.
Natalie, thank you so much. That was wonderful. As you can see, there is a lot of effort across our entire state to be able to support and assist in prevention efforts. All right. We are moving into the next phase of our agenda today, where we're headed into breakout sessions. So Rebecca, if you wouldn't mind sending us through cyberspace, and we'll all meet our group shortly.
Have a stretch break.
All right, we're gonna get ready with the stretching break today. We gotta loosen up here. It's almost Halloween. We got a spooky stretch. Take your right arm, bring it across your chest, and tighten that just so we can loosen up here. All right, switch it to the other side. It's gonna get you moving after all of this good information. Take your right arm, put it up over your head. Stretch that back of your arm. And then I want you to lean to the side. Oh, feel that stretch all the way down your side. Switch arms, do it with your left arm. Feel that stretch. Stretch all the way down to the side. Perfect. Bring your arms down. Go ahead and drop your head like you're a dead zombie. Roll it to one side. Feel that stretch in your neck. Roll it over to your other side. Feel that stretch. Kind of loosen up. Take your shoulders and I want you to fold yourself in half. Bring your arms together like a taco. Yeah, stand up if you need to. Fold yourself in half the other way. And if you want, you can grab your arms behind you. Get that stretch of those shoulders. All right. Bring your hands in front of you. Pull it like this so you can stretch your arms. Stretch your hands. All right, and last stretch, stand up, go onto your tippy toes and reach for the ceiling. Go as high as you can and just get that long stretch. All right, and we're gonna close with 3 nice long deep breaths. Hopefully that was a nice little break for you. Breathe in through your nose and out through your mouth slowly. One more time, in through the nose. Out through your mouth slowly. And this last breath, when you breathe out, I want you to keep breathing out until you can't breathe out anymore. Breathe in through your nose. Out through your mouth till you can't breathe out anymore. Keep going, keep going, keep going, keep going. Okay. Thanks for joining me for that spooky stretch, everyone. My name is Charity Jensen, and I am a lifestyle coach for the Bear River Health Department, and I absolutely love what I do. That's just a small snippet of some of the things we do in class to get people involved. We do get them moving and do stretches and things like that. One thing I love about the National Diabetes Prevention Program, and I'm so passionate about, is the ability to empower people to make changes in their life. When I was 14, I was actually diagnosed with type 1 diabetes, and my pediatric doctor told me, you can either let diabetes define your life and you can accept it and expect all of the consequences that can come from it, or you can define what it's going to be like in your life, and you can try and take as much control as you can. And that was empowering to me. And so I love to turn that same empowerment and encouragement and motivation to people who have been deemed as pre-diabetic and who are feeling discouraged and feeling like it's their genetics and there's nothing that they can do, and seeing them take the National Diabetes Prevention Program, make those small changes, and they start to see their A1C go down and they start to prevent it. They feel better, they look healthier, and they're happier. And the best part is that it's sustainable. We can maintain it. It's a lifestyle change program. Thank you so much for being here today and your interest in the National Diabetes Prevention Program for your worksite, because I've seen it change the lives of so many people. Thank you so much. And with that, I'm going to turn it over to Sarah Hodson for the last part of our virtual summit today.
Thank you, Charity. What great stretches those were, and so nice to take those deep breaths, and also just to hear from Charity and what it's like to be a lifestyle coach. And our state is full of fantastic lifestyle coaches like Charity who are dedicated to try to improve people's lives. So thank you so much, Charity, for that. And welcome back, everyone, to this final session of our virtual summit. We hope you learned a lot in your breakout sessions. And as we mentioned before, the sessions are being recorded and we'll have information to share after in case you're interested in knowing what happened in the breakout sessions you weren't able to attend today. Like Charity mentioned, I'm Sarah Hodson. I'm the Executive Director of Get Healthy Utah, and we are really excited to be part of this summit today and part of the planning effort. And even more excited to be part of this statewide collaborative effort to prevent type 2 diabetes in Utah. And I hope that you've gotten the feeling today that it really is a statewide and collaborative effort that we're all working on together. So thank you for being here and for joining us for this final session. It's going to be really fantastic. We have two great speakers for you today, and I have the privilege of introducing Representative Suzanne Harrison. We're pleased that she took a few minutes out of her busy day to join us. Dr. Harrison represents Utah House District 32, which represents the people of Sandy, Draper, and White City in the legislature. She's a board-certified medical doctor at Riverton Hospital and is a champion for affordable health care, economic prosperity, and ensuring that Utah is a great place to live, work, and grow up. So thank you, Representative Harrison, and I'm going to turn the time over to you.
Thank you so much, Sarah, and thank you to all who are participating today. This is an important summit on how we can prevent one of the most devastating diseases that I see in my patients every day in the operating room. This is critical. One of my side interests in the legislature is how can we make healthcare more affordable, and programs like the National Diabetes Prevention Program is an evidence-based, results-based program that we know works. There's been years of study and research on this. It works, and it works when employers support it. And ultimately, we all know that having healthy employees and having them more productive at work helps employers, and it also helps our state as well, because this is something that is devastating to patients and families, and anything we can do to help prevent diabetes is important and also very cost effective. I want to encourage you to look into the private and public partnerships that make this program available to you as employers. Our Utah State Department of Health has developed an infrastructure for classes throughout the state, and they can be used to help your employees be as healthy as possible. Please reach out to them and develop a program that works for you. The National Diabetes Prevention Program is flexible. It can be tailored to meet the needs of employers and employees with options that are in person, online, and on site. And I am committed to having programs like this be available to more people in our state. I filed legislation this year to expand the National Diabetes Prevention Program to some of our patients in Medicaid. And I am a huge believer. One of the first things we learned in medical school is preventing illness and treating illness before it becomes a huge problem for patients is one of the most cost-effective bang for your bucks that we can do. And ultimately, it's the right thing to do for patients' health. So thank you all for your commitment to a healthy Utah, and thank you for participating today. And thank you to all who shared their expertise. It's now my honor and pleasure to introduce Dr. Liz Joy. I met Dr. Joy through her work and advocacy on clean air and the harmful impacts that our pollution has on our health. But she is a powerhouse of working to improve the health in the state of Utahns here. And she is Senior Medical Director for the Nutrition Services and the Office of Health Promotion at Intermountain Healthcare. Dr. Joy is the past president of the American College of Sports Medicine and serves on the Exercise is Medicine Governance Committee. Dr. Joy leads research initiatives at Intermountain Healthcare to advance best practices for prevention of diabetes and promotion of wellness. Dr. Joy, it's a true honor to turn it over to you, and thank you for your work and service.
Well, thank you so much. And I just tuned in as you were kind of finishing up your remarks. I was in clinic today seeing patients, stamping out diabetes time after time. And it was just thrilling to hear your commitment, Dr. Harrison, to the National Diabetes Prevention Program. Needless to say, I'm a really big fan of this program. And, you know, my path into diabetes prevention really came from my sports medicine background, let alone my family medicine background. But just realizing the power of a healthy lifestyle when it comes to preventing one of the most common and most expensive chronic conditions that we deal with in the United States. So I think really now is the time. And I titled this presentation Now More Than Ever, you know, largely because of, you know, the certainly the challenges, you know, that the COVID-19 pandemic has brought to us. You know, we are, you know, this is certainly an unprecedented time when it comes to how a pandemic is influencing our lives, but even more importantly, our lifestyles and its underlying lifestyle that is such a profound contributor to chronic diseases like diabetes. So can I have my next slide, please?
Dr. Joy, will you try controlling on your end? Let's try it one more time, see if we can have you control. No luck?
Wait a minute, it's just, it did for just a second. Did you do something on your end, Trey? Wait.
There we go.
There we go. All right. So I kind of alluded to this, right? That, you know, now more than ever, and why diabetes prevention now? Because, you know, we keep talking about these surges, you know, in our pandemic. But, you know, many of us who work in diabetes prevention realize that, you know, the next surge might in fact be a surge in cases of type 2 diabetes because we are at home, you know, like the picture in the lower right-hand corner. You know, we're sitting at our desks. We're sitting more than ever, according to data from Fitbit. We're eating more salty, sugary snacks. And when people call it COVID-19, they're sometimes referring to the 19 pounds that they've gained during the COVID pandemic. And so I think it's, you know, incredibly important that we're having conversations about diabetes prevention, because otherwise we're going to be dealing with the next pandemic. And again, you know, given our current prevalence of diabetes, you know, 30 million people in the United States, it represents 9% of the population, 95% of which is type 2 diabetes, which is largely driven by lifestyle. And it's estimated that by the year 2030, you know, that number will nearly double to 55 million people with diabetes at an estimated cost of, wow, that's a lot of zeros, $622 billion a year. Now, you know, some would say that, you know, that it's diabetes, you know, that threatens to kind of bankrupt our healthcare systems because of all the downstream consequences related to diabetes. It's the #1 cause of blindness, chronic kidney disease, and amputation. And, you know, a significant proportion of people who have coronary artery disease and who have a heart attack have underlying diabetes. as a precursor. So, and, you know, I think it's about making it real in this, again, unprecedented times. We know that conditions like diabetes are associated with worse outcomes when it comes to infections with the SARS-CoV-2 virus. Hospitalizations are up to 6 times higher and deaths up to 12 times higher for COVID-19 patients with underlying conditions like diabetes. So it really kind of comes home when you consider the prevalence of prediabetes and diabetes, and now dealing with a pandemic, you know, that has affected, I think, 8 million people in the United States. So we're going to go from making it real to making it local. And this is a slide that I borrowed from some colleagues at Select Health, Intermountain's insurance company. And it's looking at the per member per month expenditures in 2019. And boy, the writing gets really small in some of these boxes, but notice the size of the box for diabetes. You know, nearly $100 million a year is spent on the care of people with diabetes within the Select Health insured population. And so, you know, when we're talking about trying to make healthcare more affordable, you know, for our entire community, it's really about trying to, you know, decrease the cost of preventable conditions. And Dr. Harrison really, you know, said it well to say that, you know, in medical school, in our residency training, in our continuing medical education, you know, we constantly hear about prevention and about the importance of preventing, you know, chronic conditions and acute complications on top of chronic disease. And that's certainly the case with diabetes, when you consider that 95% of it is type 2 diabetes and is largely preventable. So what is Intermountain doing to make it preventable? Well, gosh, we started the diabetes prevention program back in 2013. And when I came to Intermountain and joined the diabetes development team, you know, I sat there quietly for a couple of weeks, maybe even a couple of months, and listened and learned. And I kind of nudged a colleague one day, you know, in the meeting and said, "Excuse me," I said, but do you guys do diabetes prevention, you know, as part of this development team? And the answer was no. We do diabetes management. We're great at diabetes management. And I'm like, huh, okay. I said, you do know that there's a national diabetes prevention program and it's super successful. No, didn't know about that. And this actually probably was a conversation I had in 2012. Well, by 2013, you know, we started our diabetes prevention program, and it includes, you know, the 3 elements in this slide. So we developed a pre-diabetes 101 class. It's a 2-hour group class. It's taught by mostly our registered dietitians, some certified diabetic educators. The classes have largely been in person, although certainly with the pandemic, we have developed a virtual curriculum. And we really see this as a patient engagement tool. It's free of charge. Anybody can go to it. And we encourage people to bring other family members, because you don't prevent diabetes in a vacuum. And oftentimes, you know, it's, if people are married, it's good to bring a spouse. Or maybe an adult child if they live in the household, because it's really about changing lifestyle habits for the entire household. We offer medical nutrition therapy. This is individualized counseling with registered dietitians. It's available in our hospitals and clinics. And what I really like about medical nutrition therapy is it's a personalized eating plan and behavior change plan. And everybody's a little bit different. And a lot of people learn better one-on-one, you know, with a plan that's personalized for them, you know, compared to learning in a group setting. Also virtual, given the pandemic. And then we have the Way to Health program. And Way to Health has been around for a long time. I mean, gosh, more than 10 years, probably close to 15 years. And we kind of rearranged and expanded the Way to Health program several years ago so that it was consistent with the CDC DPP curriculum. And now the Way to Health program is a fully recognized CDC diabetes prevention program. As people know, that's 16 sessions over 6 months, along with monthly visits over the subsequent 6 months. It's taught by Intermountain registered dietitians, and has been incredibly successful in terms of helping people achieve clinically meaningful weight loss and prevent type 2 diabetes. And then we also offer the OMADA program. We did our first pilot program with OMADA back in 2016. We've been offering it to Intermountain caregivers and their adult dependents for the past almost 2 years. We've had over 2,000 people go through the program. It's been very successful. And now we are doing a demonstration project with OMADA to care for patients. And I want to talk just a little bit more about these programs. And they definitely, from the kind of upper left hand to the lower right hand, and OMADA, which is of course a fully recognized DPP, they range in intensity. And, with Prediabetes 101, it's 2 hours, it's information. But for a lot of people, we have found that, information is actually all they need. When you think about kind of the stages of change, from pre-contemplation to contemplation to preparation to action to maintenance, I love it that can just roll off my tongue these days. But people who are in, preparation, or maybe contemplation. Let's go back to contemplation. So they know they have prediabetes. They just haven't quite made the commitment to do something about it for any number of reasons. And what we have found with Prediabetes 101 is it's a bit of a nudge. It's enough information to kind of get up off the couch, to start to make some changes, to realize that, the possibility of preventing type 2 diabetes is real. And even though so many people in the family have developed type 2 diabetes, it doesn't mean I have to develop type 2 diabetes. So we really see the Prediabetes 101 class as a nudge. And for some people, that's all they need. Medical nutrition therapy, that may be a little bit more of, kind of a push. It's like, here's the deal. And these are the changes you need to make. And I'm here to support you. And let's work on a dietary prescription together. And maybe the Way to Health program is a little bit more of a shove, right? Because it is a much more comprehensive approach, to lifestyle change over the course of a year. And the same thing would be true with OMADA. So you kind of move from a nudge to a push to a shove. And different people need different levels of support. And, we've been very intentional at Intermountain in developing all different levels depending on the needs of the individual. So this is kind of what we refer to as diabetes prevention for all. And when we think about, what's available to our patients, to Intermountain caregivers, to our employees, to our Select Health members, and to our community, we've tried to be thoughtful in terms of providing a spectrum of services to meet different resources and different learning needs. And this is kind of the scope that we have developed. So we do not have a one size fits all. I pretty much don't actually believe in the one size fits all approach, to healthcare. And I'm sure most of the healthcare providers on the call today would agree with that. And we're fortunate to have some great partners like with OMADA, and Intermountain has really come together, to deliver this suite of services, and it has been successful. Let me go back here. I think another reason why our program, has been successful, and I'm going to show you some evidence of that success, is that we've been very committed to a data-driven approach, to improving the program and delivering a program that is a great patient experience, but is also very effective clinically. And again, a great team. I work very closely with Dr. Kim Bruneschultz, who is a data scientist, senior scientist at Intermountain Healthcare, and has been a part of our diabetes prevention program from the very beginning. And it's really that commitment to evaluation and research, that has allowed us to continually improve the program in order to have a program that meets the needs, again, of a diverse population. And what we have really done here is then, translate that research, into practice. And what we've been able to demonstrate especially to our leaders, which in turn helps us get more resources, to actually expand the program, is that if you look at the box in the upper left, this is looking at all enrollees in our diabetes prevention program, whether they did pre-diabetes 101 or medical nutrition therapy or way to health, compared to a group of patients with prediabetes who did not participate in a program. A significant, a highly statistically significant difference in achieving a 5% weight loss. So regardless of the program, that you're in, you are more likely to achieve clinically meaningful weight loss. We also, in the middle box, it's looking at the odds of actually developing type 2 diabetes. That's the lower bar here. Let's see if I'm not sure if my arrow works here. But again, we see that participants in the diabetes prevention program are more likely, to achieve a 5% weight loss and are less likely to develop type 2 diabetes. And we saw the same thing at 2 years when we looked at that same cohort. So it was effective at 1 year, and the program was also effective at 2 years. So there appears to be a sustainability to the effect. And ultimately, we looked at a statistical figure called number needed to treat, within our own diabetes prevention program. And we need to treat 13 people to achieve a 5% weight loss. Now, I think we've got 40 or 50,000 people, in our pre-diabetes registry. So, it only takes 13, to treat 13 to achieve a 5% weight loss. That's pretty phenomenal. And 54 to prevent 1 case of type 2 diabetes. So regardless of kind of how you look at this, the program that has been developed with a focus on, creating different strategies for different people with different needs, that approach has been very successful for us. And so taking all of that data and continually improving the program, we have continuously updated our diabetes prevention care process model. And you see that on the left, and something we refer to as a best practice flashcard on the right, which is available on a smartphone app for our providers, in order to reference that at the point of care when they're working with a patient who's perhaps come in for a clinic visit. Now, the diabetes prevention care process model was last updated last year, and it is freely available on the World Wide Web. So if you are on Google and you type in Intermountain Healthcare Diabetes Prevention Program Care Process Model, that will be the first thing that pops up. And it's not a very long document, but it's a nice reference tool on just diabetes prevention in general. And then it kind of goes through our clinical algorithms and recommended treatment and outcomes or metrics of success. So if you're interested in learning more, again, you can Google Intermountain Healthcare Diabetes Prevention Program Care Process Model, and it pops right up. Okay, so, I talked about the suite of DPP lifestyle programs that we developed, 101, MNT, and Way to Health. And then we added to our menu of services, Omada. And gosh, I learned about Omada a really, really long time ago, and have really enjoyed working with them over the years. And our leadership was so impressed with their program that through our investment arm of Intermountain Healthcare, we did actually invest in Omada Health and have gone on to expand our partnership as a way to deliver DPP services to patients virtually. And I think that the timing of this couldn't be better because certainly the pandemic has had a significant impact on bringing people together for any type of group event, whether it's a wedding or a birthday party, or group education. So we're incredibly fortunate to now have that as an option, certainly for our Intermountain caregivers and their adult dependents, but now also our patients. And I did just want to show you some of the success that we're having with our Intermountain caregivers. And this is looking at a cohort that we refer to as completers, meaning that they have completed at least 9 of the 16 lessons as defined by the CDC. And at week 52, which is really where the rubber hits the road, you can see that 44% of completers are achieving clinically meaningful weight loss. And that equates to over 12,000 pounds of weight loss. And so it's a really impressive figure. And yes, there is a group of individuals, who we refer to as weight maintainers. And we're learning a lot about that group, in terms of how to engage with them in a way that will allow them to be successful with weight loss. What we don't know about this group of maintainers is whether or not just the lifestyle changes they have made in terms of increasing their physical activity, maybe improving their sleep, maybe changing their nutrition, absent, a lot of changes in energy intake or energy deficit resulting in weight loss, if that too influences incident type 2 diabetes. So we still have a lot to learn about this group. I want to talk a little bit about how we define success. And certainly we define success in terms of enrollment in the DPP. And we have enrolled over 20,000 unique patients in the diabetes prevention program going back to 2015. And that equates to about 15%, just actually under 16%, of patients with defined prediabetes who are participating. And I think that compares quite favorably to the national figures that only 2.4% of people with defined prediabetes participate in the diabetes prevention program. So this is where our leaders want us to be, and we hear like, why aren't more people participating? And I say, well, we're just at about 16%, that's almost 8 times better than the national average. But I will tell you, we still aspire to try and get to 50%. So I think this is probably one of the most exciting slides that I'm going to present. And that's really looking at how do you define success? Participation is important, but ultimately we want to prevent type 2 diabetes. And we're not a defined cohort like the National Diabetes Prevention Program. We're a healthcare system, with people in and out, and they come to Intermountain, then they go to Revere, and they go to Granger, and they go to the U. And sometimes it's a little bit hard, to keep track of a well-defined cohort. So we've developed this approach in terms of looking at the percent who convert from prediabetes to type 2 diabetes in less than 3 years. And I won't go into a lot of the analytic details, but suffice it to say, we have gone from a high of 55% to our most recent data in August of this year down to 14.3%. So we have significantly reduced, incident type 2 diabetes, through this program. So we think we're on the right track. And there's lots of different things we're doing aside from offering all these different types of programs to our patients. We're working very closely with our providers and care teams and in providing them data regarding their screening, regarding referrals, whether or not they're prescribing metformin to the appropriate patient population, and ultimately what percent of their patients are actually participating in the diabetes prevention program, and how can they and other members of their care team help to facilitate that participation. And, Intermountain is very interested in making healthcare more affordable for everyone, and lowering the cost associated with diabetes is very important. There's been demonstration projects showing that the DPP is cost effective And, you know, thankfully no one is yelling, show me the money at me. But I'm very cognizant, you know, that, you know, if we're going to spend money on diabetes prevention, that at the other end of this, we're going to reduce out-of-pocket costs for our patients, you know, and for the entire system, and therefore make healthcare more affordable for everyone in our community. And we're doing work, you know, with our IT colleagues, you know, in terms of having registries and really trying to develop a program that certainly is very high touch and individualized, but also leveraging tech. And that tech is, you know, integrated into our electronic health record, into our data systems, our partnership with Omada, in addition to also, you know, so that's been an important part of the program. I know I'm running short on time here, and I will just say that, you know, certainly we're, as I mentioned, you know, very committed to having a data-driven approach to diabetes prevention, and we continue to perform some research and quality improvement, and we're working with other diabetes prevention exemplars from around the country, including a project with UCLA. And we have absolutely, as I mentioned earlier, ensured access to the program by pivoting all of our programmatic components, you know, virtually, in order to make it easy for patients to access the information. So I will just, you know, finish, you know, with this slide, and similar to how I started to say that, you know, now more than ever, you know, we need to focus on the prevention of diabetes. It risks being our next pandemic, and I know that everyone on this conference is committed to preventing that. So thank you so much for the opportunity to present today, and certainly happy to answer any questions if time permits.
Dr. Joy, thank you so much for all of that information and for putting everything into context and just reinforcing that evidence-based portion of national DPP. We here in Utah are fortunate that our two largest healthcare systems, both Intermountain Healthcare and the University of Utah Health, offer the National Diabetes Prevention Program. And so a shout out to the University of Utah as well. And there's lots of information available out there at their program. Sarah Hodson's going to put a link to the U of U Health info in the chat as well. So thank you, everyone. We're going to get close to wrapping up here. So we've covered a lot of ground today. Thank you all for your continued participation and attention. Just want to reinforce that there are really three ways to engage for employers in the national DPP. One is to refer your employees to a local national DPP provider. The second is to take a look at incorporating the program into a worksite wellness program. And the third is to work with your health insurance carrier about covering it as a health benefit or even offering it on site for employees. Some next steps, what you can expect. First of all, recording and slides today from our sessions today will be emailed out. The second is any questions that were not answered in chat will be answered in a follow-up email. Third is to just bring your attention to, I imagine everybody's seen a little note in email through registration process about a market assessment. The market assessment was developed by NICDD and just does a really helpful job of helping us to know where employers throughout the state are at in relationship to diabetes prevention. So a number of you have already completed that assessment. Dustin's going to put the link to the assessment into chat so that you could quickly complete that. And for all of those who have completed, as well as anyone who completes the survey between now and Friday, November 6th, we will actually be giving away 2 electronic gift cards to people who complete the market assessment. So thank you in advance for your participation. And one last big request to all of you. We really need and appreciate your feedback. We want to continue to have events such as these and to continue to have this conversation in our state. And so within a little while after the end of our event, you'll be receiving an email, a link to a survey. And we appreciate in advance the time and effort to complete that survey. Lastly, we are all here to support you. We work in this work every day and have are familiar with the resources available and how to be a concierge through your organization's consideration of the National Diabetes Prevention Program. We will be reaching out to you, but we also encourage you to reach out to us directly. So here's some contact information for folks. We want to thank you for being here today. And I think we might have 60 seconds, maybe 90 seconds. Dustin, are there any questions in chat that we could answer before we let everybody go?
It does not look like there is any chats unanswered.
Okay. Are there any, if anybody has, we do just have a couple quick minutes. If anybody has a quick question, to remove yourself off mute or put it in the chat. We want to get every second out of today. All right. Oh, go ahead. Are there things there, Dustin?
No, just people saying good job and thanks.
Wonderful. Everybody, thank you so much for your participation today. And we look forward to continuing our partnership for healthy work sites throughout our wonderful state. Take care.